The news is live on Joy 99.7 in Accra, Love 99.5 in Kumasi, affiliate across Ghana's 16 regions, including Bedouin FM, Bumprugu, Sun City Radio Keta, Volta Premier Hall, ATL FM Cape Coast, Radio Max Takrady, and Rage 104.9 in Tamale. We are live on Facebook live stream and my Joy Online interactive app. The midday news is sponsored by Petrosol, your clean fuel in full quantity. Petrosol, always a delightful experience, and Duraplast Ghana Limited, producers of quality PVC pipes and water tank. Where Duraplast goes, water flows. Coming up, World Health Organization concerned about measles outbreak in parts of Ghana as it calls for immediate targeting of babies yet to be immunized.
Measles outbreaks highlight that we have a group of children who have not been vaccinated, that coverage is low, and so it is important to catch up and address that.
We have details as the WHO reveals it has extended vaccine acquisition support for Ghana. Also, Upper West Regional Health Directorate to deploy biomedical engineers to assess and repair non-functional theatre lamps at the district hospital, which has forced doctors to use mobile phone lights for surgeries.
We had a man who came in a hole in the stomach, and I had to use two lights, one on one side and another on another side, phone lights, to be able to see clearly.
We will dispatch our biomedical engineers to the hospital to assess.
Also, in this package, an estimated 15,000 jobs on the line as government's debt exchange program forces suspension of works on the Kumasi International Airport, Phase 2 of the KJTR Market Project, and the Komfanoche Teaching Hospital maternity block.
One of which is a fact. As part of government's debt restructuring exercise, some contractual agreements need to be suspended, which includes these international contracts with some of these. And so it's not only the KGTR market.
We'll take you to Kumasi for an update on the situation. And as the Ghana Revenue Authority demands importers subject their goods deemed highly dutiable to thorough checks and validation, a tax consultant says the authority cannot escape blame for the leakages in revenue collection.
Somebody brought 2014 Range Rover vehicles, brand new, through Takrady Port. None of them was described as Range Rover, described as Citroen 203, Peugeot 205. None of them was described as Range Rover.
Also this afternoon, there are huge gaps emerging in revenue collection, especially in corporate tax, where 85% remain uncollected despite the push for revenue generation.
You lodge in a hotel, you are checking out, they write a receipt for you. I said, this is not the VAT receipt. Two things. Either he is not charging the VAT, or he is charging the VAT, but he's not accounting for it.
And in sports,
an executive council member of the GFA justifies the absence of home-based players from Ghana's 25-man squad for the upcoming AFCON qualifiers.
We'll also be giving you the latest inflation rates for February and an ending controversy on the planned reintroduction of road tolls. The former workers want to know when they'll be back in the booths, but experts are urging government to rethink immediate price adjustment.
We should start from the normal rates that we have. Let people get used to the situation again. Now go ahead and do an increment in it.
Details of these and more here on the Midday News with me, Bernice Abubedulansa. Thanks for choosing us. This is Joy News, independent, fearless and credible. It's a pleasure to have you here. The details now. The World Health Organization says it's concerned about measles outbreak in parts of Ghana. It wants the immediate targeting of babies yet to receive the vaccines to stem the spread. Parts of the country has been hit by the outbreak following weeks of shortage of critical vaccines. Deputy Director General Dr. Anshu Bunjerji has been speaking exclusively to my colleague Blessed Suga.
Measles is a very infectious disease, and we have seen measles outbreaks increasing globally. So with that reduction in coverage, what we see often is that we need to organize some kind of catch-up campaigns to find the children who hadn't received the measles vaccine earlier. Indeed, measles outbreaks highlight that we have a group of children who have not been vaccinated, that coverage is low, and so it is important to catch up and address that.
You heard Dr. Anshu Banerjee, he's Deputy Director General of the World Health Organization. My colleague Blessed Suga, who spoke to him, joins us with more. Blessed, we know support for vaccine procurement has been an issue. What exactly is the WHO doing to help?
Indeed, through the Vaccine Alliance called Gavi, Ghana was receiving help to provide these 3 essential vaccines and immunization at no cost to the parents at all. But that funding program is elapsing this year, and it accounts for the reasons why the Ministry of Health, together with the Ghana Health Service, were having some challenges accessing the vaccines for these children. But now there's a confirmation from the World Health Organization that there's an approval, and that through the vaccine platform known as Gavi, that extension will be granted, which will mean that immunization will be done at no cost at all to all of these parents across the country. And in terms of the measles outbreak, the World Health Organization boss has been touching on why there's a need to show up vaccination to deal with that threat, which challenges universal health coverage.
So I think in relation to Gavi, there has been an extension for Ghana to still benefit from the support from Gavi, and what Gavi of course provides is that it has ensured that vaccines are available at a much lower cost for low-income countries in order for them to be able to introduce it. And this is a huge advancement in equity, I think, because every child globally should have access to the same vaccines in order to protect, let's say, itself from him or herself from life-saving or diseases, let's say. So this has been a tremendous achievement from a global public health perspective. Now, Ghana indeed needs to look at how to finance, let's say, 100% of their vaccines after a couple of years. The Gavi support is still going on. But of course, Ghana has made tremendous progress because the way that Gavi works is not that you benefit from vaccines up to, let's say, 2023 or 2024, and then you pay 100% of the vaccines. What happens is that you slowly start co-financing the vaccines. So Ghana actually already pays for most of the share of the vaccines that are coming through Gavi to the country. So it's going to be a little additional investment that the government needs to make, because Ghana has been one of the front runners, let's say, in benefiting from the Gavi provided schemes.
Deputy Director General of the World Health Organization, Dr. Anshu Banerjee, speaking to my colleague Blessed Suga. That full interview will air on Foreign Affairs at 10 p.m. on the Joy News channel. Do make a date on Friday. Still on health, the Upper West Regional Health Directorate says it's deploying engineers to assess and repair damaged theatre lamps at the Yaw West District Hospital. Officials there told correspondent Rafiq Salam the situation has forced them to carry out risky surgeries using mobile phone lights.
Among the plethora of challenges faced by the Yaw West District Hospital is a lack of a theatre lamp. The theatre lamp for 2 years has broken down. Authorities at the hospital have made several attempts to repair it, but has not yielded the desired results. Medical Superintendent of the Yaw West District Hospital, Dr. Benjamin Amiyur, says the lack of a theatre lamp is greatly affecting healthcare delivery at the theatre.
Permit me to say that it's only one that we have. Ideally, we should have had an overhead one and then a standing one. But we've had a standing one for the years now, and unfortunately that only one that we had also broke down. It's really affecting service because the lamp is the second eye for us, for both the nurses and the doctors when you are doing an operation. You have your own eyes, but when you are operating and you go into a cavity, a body cavity, you will not be able to see clearly. And it's like walking in the night without a torchlight. You would see that movement will be difficult. In the same way, navigating our way through the surgical procedures that we do is a bit challenging, but we've had to do without them for close to 7 to 8 months now.
How is he able to perform surgeries without the theater lamp?
There are times you would have to ask 2 or 3 people to help with their lives. Let me just give you an example. Just this Monday, we had a man who came in with a gastric perforation with peritonitis. In layman terms, a hole in the stomach. And we needed to close the hole to avoid the contents from the stomach from leaking out into the entire cavity. And I had to use 2 lights, one on one side and another on another side, full lights.
Rafiq Salam filed that report, while the Upper West Regional Health Director, Dr. Damien Punguyiri, says he's unaware of the situation, but his experts will be tasked to repair the lamps.
We will dispatch our biomedical engineers to the hospital to assess, find out if it is indeed broken down and whether they can work on it, because they have been working on not only that hospital equipment, but across the other hospitals. So if they can work on it, they fix it. If it cannot be worked on, then we will know what to do.
Okay. But okay, I guess you do have meetings, regional meetings, if not weekly, monthly, to understand how health in that part of the country is doing, isn't it?
Yes, we do.
But within those your meetings, it hasn't come up that this lamp has been destroyed.
Yeah, we have no information, and I think that usually we don't want this to be the first to hear it from the radio station or TV station. Is something that we don't really want. Thank you for bringing it up, but we will take it up from there.
Upper West Regional Health Director Dr. Damien Punguyiri speaking to my colleague Samuel Kojo-Brace earlier on News Desk on television. Away from health, jobs of an estimated 15,000 workers on the Kumasi International Airport, Komfanochi Teaching Hospital Maternity Block and the KJTR Market Phase 2 projects are on the line following suspension of these projects. This is due to government's external debt exchange program negotiation with the Paris Club. The development put the completion dates of these projects to an unknown state. The mayor of Kumasi, Samuel Pine, confirmed this development, saying the decision affects other important projects across the country as government works to secure a $3 billion loan facility from the IMF.
I did have some discussion with the contractors, one of which is a fact. As part of government's debt restructuring exercise, some contractual agreements need to be suspended, which includes these international contracts with some of these. And so it's not only the KGTR market. So here you have the airport and the Kumasi, the maternity and children's. You go to Takrady, you go to Tamale, and there are some of these projects, even including part of the Sino Hydro projects, are on hold now until agreement with the IMF. But they have some staff on site working. When you go to KGTR, for instance, at the Central Market, for instance, they are not doing steel works. So they told me, yes, they're not doing concrete work. So it doesn't make economic sense to keep concrete workers on site and pay them for no work done. So that's what they do. You go to the airport, they have similar situations. You go there. So that's why but it's not that they're putting them, they're sacking them eternally, because of also cutting down the operational costs.
Mayor of Kumasi, Samuel Pine there. Let's go live to Kumasi when Nanaya Ojima joins us from. Nanaya, give us an update on the stages of these 3 projects.
So let's start from the Komfanochi Teaching Hospital, where a maternity and children's block is being built. It's supposed to be a 750-bed facility being constructed to replace the old mother and baby unit whose construction was abandoned decades ago. Now the project was being constructed with a 155 million euro loan facility, and from our check, civil works at the Komfanochi Teaching Hospital project between 75 and 80% as at the time the contractors were leaving the site. However, how work done there was about 20%. So when it comes to the civil work, it's almost complete. At the Kumasi airport, we were told last year that the contractors at the airport are 2 months ahead of schedule. The terminal building is over 95% done. Installations are done. Some simulation exercises have already been done, paving way for the usage of some of these facilities. What we know now is that the control tower and the runway are the areas where there are still some work to be done. Notwithstanding, the airport is near completion. And so at the KJTI market, when we checked, some works were still being done. That's the steel works were being done. The panels for the ground floor and some of the floors had already been done. So far, what we are learning is that they have very few workers on the ground who are still doing some steel works.
Right.
That's the update on these 3 projects in the Ashanti region.
Nanaya, quickly and briefly give us an update on what the workers have been saying.
It was expected that some of the steel workers at the Kumasi airport, after they had completed their work, would be brought to the KJTI market to also help with the construction there. Most of them have been left to go home, and they believe that they should have allowed them as one contractor working on all these construction work. They were promised that when one of these will they'll transfer some of these workers to the other side. But
Nanaya Agyemang joining us from the Ashanti region capital, Kumasi. You're still listening to the Midday News here on Joy 99.7 FM. A tax consultant, Dr. Abdallah Ali Nachia, is blaming the Ghana Revenue Authority, GRA, for the leakages in revenue generation despite efforts to block them. Ghana is among the lowest countries in the world with poor revenue generation. Undervaluation, corruption among customs staff, poor inspection of goods and others have been blamed for the anomaly. The Ghana Revenue Authority, in a memo to sector managers, is demanding a thorough validation of goods deemed highly dutiable in a move aimed at improving efficiency to achieve the projected target. My colleague Elton Brobe joins me in studio for a quick chat on that memo. Elton, what more is the memo saying?
So, Ben, this is coming from the sector commander, and it is to all unit sectoral heads dated March 9, 2023, and it says directive on highly dutiable goods for checks and value validation. And the memo says that they should undertake thorough validation of all goods before, coming up with the right duty to be paid by the importers.
And these goods, what are they exactly?
So we have tomato paste and sardine, canned products, steel and steel-related products, alcoholic beverages, beer, wine, liquor or spirit, all non-alcoholic beverages, all paper and related products, aluminium, circles, supermarket goods, traveling bags, computers and related products, frozen foods, rice, cooking oil and textiles.
Elton Brobe there with details of a memo sent by the GRA to sector managers. Meanwhile, tax consultant Dr. Abdallah Ali Nachia says there are too many leakages in revenue collection. He blames the GRA for the challenge. He was addressing a workers' retreat organized by the Controller and Accountant General's Department.
The minimum you should make as a country if you want to develop is to have a tax GDP ratio of not less than 15 to 20%. We've been hovering between 13.5 for the past 3 years. So for efficiency and effectiveness, that is why I don't want to see new taxes. Let's block the leakages. And I remember when I gave a lecture at ICA at Movenpick Ambassador, if some of you were there, I talked about an incident of illicit flow in 2015 when somebody brought 2014 Range Rover vehicles, brand new, through Takoradi Port. None of them was described as Range Rover. 14 vehicles described as Citroen 203, Peugeot 205. None of them was described as Range Rover. That's illicit financial flow.
While it's also emerging, the GRA is only collecting a paltry 15% of corporate tax. Dr. Ali Nachia says there's too much laxity in the system, allowing for evasion by taxpayers.
A research by Opoku and Tanaka in 2020, corporate tax gap was estimated at 85.6%. So we are not collecting 85.6% of corporate taxes we should collect. We are not collecting. So we are collecting less than 20%. And this 85.6% is equivalent to 12.7% of GDP. So if we add it to the 13.5 we are collecting, tax GDP ratio, you see where we are. We are almost 30%. Do we need new taxes? Do we need to increase taxes? Free zones, we are losing about 81.6%. I've traveled to Wa, Kumasi. You lodge in a hotel, you are checking out, they write a receipt for you. I said, this is not a VAT receipt.
Dr. Alina Chia is a tax consultant. You're listening to the Midday News here on Joy 99.7 FM. Stories gone by. World Health Organization concerned about measles outbreak in parts of Ghana as it calls for immediate targeting of babies yet to be immunized. Still to come, unending controversy on the planned reintroduction of road tolls. The former workers want to know when they'll be back in the booths, but experts are urging government to rethink immediate price adjustment.
We should start from the normal rate that we have. Let people get used to the situation again. Now go ahead and do an increment in it.
I bet your mirror is tired of seeing your talent. And your bathroom is tired of hearing that beautiful voice. Well, this is your time to shine, right from wherever you are. Go on and change your world with Ghana's best data bundles. Simply dial *111# for huge data for less. Airtel Tigo. Life is simple.
Keys. What could be simpler than a key? Who doesn't have a key? A car key, an office key, a drawer key. But there's one key that rules them all. The house key. The key to a place we call home. The key to the home where everything comes together. The key to a home that is our own. A home where we make life happen with our families and loved ones. Adoha has been working hard for over 30 years to make home ownership within reach for many. Say yes to property with Adoha. Your dream home is one call away. Your dream home is a few clicks away. Visit our Accra project, The Place, by calling 030-2789-757.
Imagine say water wake up at dawn. You know both. You know chop. Where it vanish for your area for 2 weeks. You not get one drop safe inside your tank.
Hey.
Hajia, our life was in dangerous. Only our neighbor get water with water tank.
Water tank?
Yes, water tank. Mamma mia, that water tank get meter for checking water level. That water tank be fine past Kumasi Selendion. That water tank be tough like Ghana Army. That water tank, they carry water pepe, so say some no go left inside the supply tank. What a tank! That's my boss, Mr. Poncho go talk.
Beautiful, durable, with water level indicator and accurate volume of water. Water tank. What a tank! By Duraplast.
You're still listening to the Midday News on Joy 99.7 FM. Thanks for staying. It's now time for sports with Mubarak Harina. What's the latest?
Yes, Executive Council member of the Ghana Football Association, Nana Oduro-Safu, believes the current performances of players on the local scene do not warrant a call-up to the national team. Black Stars coach Chris Houghton named 25 players for Ghana's game against Angola in the upcoming Africa Cup of Nations qualifiers. The squad had no home-based player, raising concerns about player quality in the country. Safu believes the players called up are currently better than the home-based players.
Black Star call-ups are based on your performance for a period. And I'm asking you that if we have so many players in Europe and their performance are good, juxtaposed against the local players here, they are a shade ahead of them. What do you want us to do? You cannot say because, like Mr. Kwesi Atechi said some time ago, that the call up to the national team is not a local assembly where you have quota. There's no quota. And until we decide that there should be a quota, maybe 30% should be local players, so be it.
Executive Council member of the Ghana Football Association, Nana Oduro-Safu.
Thanks, Haruna Mubarak. Now, there's unending controversy surrounding the reintroduction of road tolls. Former toll workers say they are unaware of when exactly they'll be back at post, and some analysts want government not to immediately impose the new rates. The Finance Ministry has written to the Roads Ministry seeking input on its proposed 88% increase in prices as it prepares to reintroduce the levy. The Ghana Private Road Transport Union GPRTU wants further engagement before reintroduction. Samuel Amoa is Deputy PRO.
Those places are properly maintained before bringing in all this, because you can't just ask the people to come back and sit in at the same place and be collecting the tools like how it is right now. And even there are some other areas when you go there, and I remember I traveled to Kede. When I get to Kede, I saw the toll booth over there. It was serious.
Samuel Amo is Deputy PRO of the GPRTU. On his part, finance lecturer at the University of Cape Coast, Seram Kawo, said government should rather keep the rates at the time of suspension and slowly adjust prices later.
The reintroduction of these road tolls now is just telling us that government is indecisive when they want to implement policy. So for me, let us introduce it. But let's start from where we left. And when people are used to the situation, we can now come back to increase it and make the revenue we need from it.
Finance lecturer at the University of Cape Coast, Seram Kawo there. Well, the Toll Workers Union says it's yet to be engaged on when exactly workers will be back at post. Here's its chairman, Henry Dugbe.
During 2021 budget review by the finance minister, that the tolls will be abolished in the country. And all the toll workers will actually be reassigned. And until they are reassigned, they will be paying them monthly. But all those bargains, they couldn't actually fulfill none of it. So it was yesterday that we heard that they are bringing back the toll. So we were very happy.
You heard Henry Dugbe, chairman of the Toll Booth Workers Union. Away from that story, the year-on-year inflation for February was 52.8%. This is a reduction from the January figure. This figure was influenced by the drop in transportation and other non-food items. This is the second consecutive time the figure has dropped in 20 months. Addressing journalists on the new rate, government statistician Professor Samuel Anim hinted the reduction is a confirmation of a sustained downward trend in the rate of inflation for the year.
Given these two price indices for the month of February 2023 and February 2022, inflation for the month of February 2023 stood at 52.8%. This indicates that prices of goods and services on the average between February 2022 and February 2023 have gone up by 52.8%. That is, prices of goods and services over a one-year period, specifically February 2022 and February 2023, went up by 52.8%.
Government statistician Professor Samuel Anim there. And before we go, a typical Ghanaian community is unique because of the people who live in it, how they relate with each other traditionally, and sometimes how closely knitted the community is to others. Today in our Ghana Month series, we take you to the Napdam district of the Upper East region to tell you how 5 communities together, called the Zoliba people, and how a majestic mahogany tree binds them together because of their common ancestor. Correspondent Albert Sori reports.
Pelungu, Damolgo, Lore, Zanlergu, and Daglega. These are 5 distinct communities, each with their chief, elders, and people. But the 5 communities together are called the Zoliba people because of their common ancestor.
Zawi migrated from Kusa Zuluk and settled at the current Lore community and gave birth to 5 people.
Over the years, the people of the 5 communities of Zoliba have continued to relate as brothers and sisters.
If there's a problem in Lore, the problem is exactly for the whole of the Zuluba community, likewise the other communities. And that's why we are one family.
But this bond between the Zoliba communities was not created just by word of the mouth. The bond is represented by this majestic mahogany tree, which is a shrine for the communities.
That is our ancestral shrine.
Albert Sorry ending today's edition of the Midday News with me, Bernice Abubeidulansa. Our top story: World Health Organization concerned about measles outbreak in parts of Ghana as it calls for immediate targeting of babies yet to be immunized. Do log on to myjoyonline.com. There are more stories, including fuel prices will go down further. Gold for oil policy, most important macroeconomic policy, according to Vice President Dr. Mahmoud Baumia. Thank you so much for your company. Do stay with us. Dr. Menso Tabel is next with Living Word.